So today what I'm going to talk to you about is a facelift. So what makes a good facelift? First of all, the definition of the facelift is different from, between all different plastic surgeons. But when at the Straith Clinic, when we discuss a facelift with you, what we're telling you is that we're going to do something to the cheeks, jawline, and neck. So if we start with, externally. So the first thing that makes a good facelift is, number one, choosing a good candidate for it. So, patients have to have, be of good, the proper age where we look at them and we think that a facelift is going to give them a nice result and it's going to satisfy their expectations. So if we start with incisions, a good facelift involves strategically placed incisions beginning in front in the hair and proceeding behind the ear and under the chin. In women, we like to hide a majority of the incision behind this portion of the ear so that it becomes much less noticeable. What you do first is you elevate the skin. The skin is not a structural organ. We don't base the results from a facelift on the skin. But you do have to elevate the skin to the proper amount to achieve a nice result, specifically in the cheek and specifically with the nasolabial fold. If we're trying to lift this, and you're only lifting up a small amount in front of the cheek, as some of the shortcut procedures do, you are not releasing the skin's ligaments, which hold it in place here. So if I pull from right here and pull back, it totally elevates this nasolabial fold compared to back here in front of my ear where it basically doesn't move. So a good facelift is going to free the skin from some of its retaining ligaments to expose what's underneath. The next thing that a good facelift has to include is some manipulation of what's called the SMAS. That is a fibrous layer in the cheek which connects with the fatty layer in the cheek, or the fat deposits in the cheek, and the muscle of the neck. You have to release that a certain amount. There are retaining ligaments that hold that in place, and again, similar to the skin, if you don't release it, you cannot lift it and reposition it. And what this layer really does is lift up and take the facial fat and place it back up into the face into a more youthful position. And it also will pull the back of the muscle in the neck, which proceeds over the chin. So if I pull from here, I can lift that muscle. The incision under the neck is required to address the muscle. A good facelift always addresses the muscle in the neck. If you are not doing the muscle in the neck, the patient probably is not a candidate who needs a full facelift. So the muscle is addressed in different ways, but in general it needs to be sewn together in the middle to prevent it from creating the bands that are present and also to eliminate the sagging that develops over time. And the other layer we deal with in that neck is the fat. So fat is removed from the neck if it is excess, but the proper amount needs to be removed. If you remove too much fat, you do what's called skeletonize the face. And that means thinning the layer of fat enough that you actually see the fine lines or wrinkles in the muscle as it contracts. Lastly, once you've dealt with that, the skin is redraped backwards, the extra skin is removed, and a little tension is placed on the skin, but a skin is never tight. Doesn't matter how old the person is, babies all the way up to older people. Skin isn't tight. It has very good elasticity as it's young, and as we age, we lose the elasticity. So it's not correct that a good facelift is a tight face. You redrape the skin, a little tension, because we know the tension causes the skin to stretch, so we're trying to accommodate that. But the skin is basically redraped, extra skin is removed, and that's what gives you a nice result and not a pulled look. It's a restructuring of the underlying tissues to accomplish that. So that's what we consider a good facelift.